Utah Department of Health today confirming our state's first case of the Brazil variant, even as new COVID-19 cases decline.
The CDC's warning that the spread of variants could cause another surge. News specialist Jed Bull shows us how the public health leaders and doctors are urging us to take precautions and get vaccinated to beat the variants.
Utah has now identified one case of the Brazil variant. That person lives in Salt Lake County and has a history of travel to Brazil. But we need to keep doing the right things to beat it.
We have confirmed over the weekend that our first P1 variant, which is more commonly known as the Brazil variant, has been identified in the state.
But you don't have to travel to Brazil or the UK to catch those strains of COVID-19 in the U.S. because they are circulating.
We're certainly seeing more and more UK variants show up, which is what we anticipated.
Utah previously identified 85 cases of the UK variant, which showed up 2 months ago.
Those viruses move around. People travel and they travel with their viruses. And that's exactly what we're seeing.
That variant represents less than 1% of all COVID cases in Utah. But the CDC warns variants could become a nationwide problem if we're not careful.
We think that there are probably more cases than we're actually finding.
Each variant seems more transmissible than the original strain. However, the vaccines seem to work against the strains, even if their efficacy is reduced. Health departments and doctors urging us to mask up and social distance until more people are vaccinated.
Those are the things that we've been doing for the past year, and they're the things that we will continue to ask people to do and that will work until we get enough people vaccinated that we start to achieve this herd immunity.
It is the race, vaccination against variants. We got to shut down the virus as much as we can so that we don't allow the virus to proliferate.
Dr. Vento is fully vaccinated, but continues to wear a mask and social distance to avoid the variants. There is no certainty that vaccination is 100% effective against catching or transmitting the variants.
On the positive side, Dr. Vento tells me that the monoclonal antibody treatment is quite effective at reducing the severity of the illness in patients.